43 Central African Time, and we're coming to you live from Johannesburg in South Africa. Thank you to Tabiso Lohugo with our business news. Now, the fourth International Conference on Public Health in Africa, co-hosted by the Africa Centers for Disease Control and Prevention and the Government of South Africa, begins tomorrow in Durban in the KwaZulu-Natal province of South Africa. The conference will set out a bold agenda anchored in continental ownership, leadership and investment. It will highlight how Africa is charting its own path to achieving universal health coverage. And to speak to us, we are joined on the line by the Principal Advisor to the Director General on Program Management at Africa CDC, Dr. Ngashi Ngongo. Dr. Ngongo, good afternoon and thank you for joining us on Africa Update.
Good afternoon and thanks for having me.
Now, Dr. Ngongo, can you briefly take us through some of the areas that will be covered in the four-day conference?
Yes, thank you very much for the opportunity. Dare to say that the theme of this conference to start with is moving towards self-reliance to achieve universal health coverage and also health security. I think that is the main theme. This conference will be gathering the scientists, the policymakers, the researchers really around Africa and some outside of Africa to come and reflect on issues that are important to Africa, to see what solutions do we need really to improve the health of the African people toward our vision of a safer, healthier, and prosperous Africa. Because the main theme is around self-reliance, I think there are four key areas that are going to be discussed in this conference. Is the issue of local manufacturing. You know that from the COVID-19 experience that Africa imports more than 90% of the health products that we consume. It's only 1%, less than 1% of vaccines that are used in Africa that are produced in Africa. Less than 5% of diagnostics we use that are produced, in Africa. That's one important theme, one important area of discussion. That there's no way we can achieve self-reliance in Africa if we do not produce our own product on the continent. And then another very important issue is related to the health financing. You have heard the health financing crisis. I think that has come since the announcement of the freeze from the United States and all the other European countries that are also embraced the same move, that really the financing of health in Africa has declined tremendously. This just got aggravated this year, but we know that over the last, since 2021, we had already seen a decline by 70% of money that is coming into health in Africa between 21 and 24. Now, this discussion is what can Africans do now to get more money coming through domestic resources, to generate more money through innovative financing, and what are the other ways that we can also engage the private sector to contribute so that most of our money can come from locally here in Africa. But also next to that is also the question of how do we then, in addition that just raising more money for health, but also building in efficiencies to get more out of the investment that we are making in health. That is one second area of discussion.
Now, talk to us about the universal health coverage and how countries implementing universal health coverage and are they getting the support that they need? You touched on something that's very key. Apart from the COVID-19 pandemic, there's also the issue of funding that has been stopped by countries like the United States, and which has left a major shortfall.
I think these crises that are happening globally affecting the continent also have a huge impact on our efforts to achieve universal health coverage. Can you imagine? We are losing about $8 billion in support that was coming from outside. It's huge. That's the reason why we are not going to achieve that universal health coverage at the same say if we do not find innovative new ways of really increasing the financing that we are getting. You know, here in South Africa, that the issue of product, just medicines, antiretrovirals, I think that were supported by PEPFAR and other international organizations, have been affected big time. Now the thinking is, okay, how do we then get those products produced on the continent and how do we fund them? That's a very important area. Another important area is the area of human resources. We still have communities that are not rich. Now we are talking about our primary healthcare system. Now we're thinking, what innovations, what transformation do we need in the primary healthcare system to be able to reach every single African wherever they can be? I think those are important ingredients that if we address the issue of the system, especially the primary healthcare system and the community health workers, and also address the issue of financing, address the issue of the supplies and medical products. Those are important ingredients that we need to be able to achieve universal health coverage. That will be the focus of our discussions here in Durban.
Now, just speaking on universal health coverage, now in South Africa, there is a pushback on the universal health coverage with the country facing mounting legal challenges. Should the country abandon its plans for its implementation?
I think universal health coverage is just the realization of health as a right. It's not something that any country should compromise on. I think the challenge is finding the most affordable, most context-specific solutions that will help us to reach every single citizen. But you cannot deny citizens of health. That's what universal health coverage is all about. But we know there are challenges related to financing. We know there are challenges related to the weakness of the system. I think those are the things that we need to face heads on. That's exactly what this conference is all about.
You touched on it very briefly earlier. Most countries on the continent are struggling with socio-economic issues, thus affecting public health outcomes. How is the conference going to assist these countries?
What the conference is going to do is that we have 55 member states in Africa. We have different initiatives that are going on this continent. There are four pillars that we are trying to look at here during the conference. In domestic financing, we have countries like Botswana, like Rwanda, that have reached already the 15% of the Abuja target. We need to learn from them. What have they done to get there? We have innovative financing, recognizing that we cannot only count on the fiscal space of our countries to find all the money that we need. We also need to look for money outside government. There are many initiatives that have been taken. We know that Ghana, for example, had introduced VAT tax, and that contributes to universal coverage as well. I think we know many countries that have also taken similar initiatives. We would like to learn from them. We have the private sector also that has got a role to play. There are many experiences in Africa that we can also bring to play. That's why this conference is bringing all those experiences, understanding what are the conditions that make them work and how we can also apply them in our own context. That's what this is all about.
Just in wrapping up, timelines, timeframes, are these going to be put in place, and just accountability for everyone, for every government that is a part of this conference?
What we want to do, I think, to transform a little bit the way that we've been running conferences in Africa, so they are not only talk shows, but they are followed up with a clear roadmap on how we are going to support implementation. Immediately after this meeting, there will be a follow-up meeting that to reflect on the roadmap that need to come. But this is happening at the same time where also Africa CDC has been tasked to put in place an accountability framework to report to the AU Summit of Head of State on the progress that we are making in health on the continent. These are some of the things that we need to put also on that roadmap so that we have a roadmap, but at the same time, we are tracking progress and reporting back to our leaders. That's the way that we want to run health on the continent following this conference.
Well, Dr. Ngongo, thank you so much for joining us. We are going to leave it there for today.
Thank you very much, and thanks for inviting me.
It's been a pleasure. That was the Principal Advisor to the Director General on Program Management at the Africa CDC, Dr. Ngashi Ngongo, joining us on the line.